doctor. So, vesicovaginal fistula, VVF, counseling. We're going to discuss about VVF counseling. You start with your normal introduction. So we all know the intro and we all know the acronyms we are following. The acronyms we are following is GATHER. Okay? So the first G is what? Is greet.
Okay.
You want to greet your patient. So probably good afternoon, sir. You want to greet your examiner. Good afternoon. Good afternoon, ma or sir. You understand? Then apart from that, still under greet, what is the next thing? Dr. Esther, what's the next thing? Dr. Favor, anybody? What's the next thing after you greet?
Ask.
Yeah?
Ask.
No, we are not done with greeting part.
Introduce yourself.
Introduce
yourself.
You introduce yourself. Very good. Introduce yourself to the examiner. Then apart from introduction, you want to do what? You want to create rapport.
Great rapport.
Yeah. Create rapport. Then the next thing is what? You want to what? Obtain consent.
Obtain consent from the...
Obtain consent. Okay? I always say the way I do my own. This is how I do my own. After greeting, let's say good afternoon, sir or ma. This for the patient. Then you want to tell the patient, you want to introduce yourself. Let's say by name, Tony Bob, comma, I understand you have a need for counseling regarding vesicovaginal fistula, VVF, okay, comma, I hope I would be of help to you today, comma, can I proceed? Question mark, you obtain consent. Then you continue. This is how you do it, please, doctor. This is very important. Here with this place, there's already element of empathy in it. So it's very important you empathize with the patient. Are you getting what I'm saying, doctor? This is very important. So immediately after you're done with this, you want to go to which other path? To the A path. It's very important. So the A path. A means ask. So what do you want to ask the patient? You want to ask about the language. Okay? You want to ask the patient if the patient is okay with the language you're speaking, or the patient wants a translator to be there with you. And apart from the language, another thing you want to also ask the patient is probably you want to tell, more like ask, but you want to assure the patient about confidentiality. So here you want to tell the patient that whatsoever you'll be discussing is strictly between both of you. So after the confidentiality part, the next thing is what? You want to talk about the settings. So you want to tell the patient if the patient is okay with the environment, or the patient wants somebody to be there with you. Then immediately after the setting, very important, you also want to talk about, what's the next thing, doctors? You talk about after setting. We said this before. You want to ask about
biodata.
Quick biodata. Thank you. Quick, still under the ask. Quick biodata. Here you want to ask about the name. You want to ask about the age. You want to ask about the occupation. Okay. Then immediately after this, the next thing is what? You want to ask
more history.
What do you call it, doctor?
Little history, like just take
quick history. Very good, thank you. All these are in the video I posted. Quick history. So here you just want, no, even before quick history, doctor, you want to ask about reproductive profile. Please take note. You want to ask about the reproductive profile. Yeah. Do you want somebody with you? Do you want somebody with you is about settings. Please take note, doctor. You ask a question. It's about the setting. If you want somebody there, you ask about the reproductive profile. So under the reproductive profile, this is a female. You ask about the LMP, the last menstrual period. You ask about the EDD if you think she's pregnant, and you ask about the EGA, the estimated gestational age and the expected date of delivery. So after this, you ask about quick history. Quick history. So under the quick history, you want to ask some few symptoms of vesicovaginal fistula. Things like maybe you've been experiencing uncontrollable urination, dribbling of urine. You want to ask, have you been experiencing things like dribbling of urine? Please take note, doctor. You want to ask this thing. This is very important. So after this, the next thing you want to go to is you want to go to your counseling improper. You are done with the basic stuff here. Do you understand, doctor? You are done with the basic stuff here. Okay. Any question, please, doctor? Any question at this point? Any question?
No, doctor. No.
All right.
No.
Let's continue. So after this whole thing, don't forget at this end, you want to ask the patient. This is the ask part. Still under the ask part, you want to ask, do you know anything about VVF, vesicovaginal fistula? In this exam, in Mdcn exam, the patient will tell you they don't know anything. Are you getting me? The patient will tell you they don't know anything. So you just have to explain improper. So let's start with the whole thing improper in full now. So as I've said earlier, you want to start with the definition. So you take your time to start with the definition. So what is VVF? Obviously, we know VVF is what? As an abnormal connection. Is an abnormal connection, or let's say abnormal communication. Communication between what and what, doctors?
Between the
bladder and vagina epithelium.
Yeah, between bladder and vagina epithelium. Okay, let's say vagina epithelia. So it's just a connection between both of them. So connection between the vagina and the distant and the bladder, urinary bladder. That's why it's called vesica. Vesica simply means the bladder. Vesicovaginal. Okay. So the next thing you want to talk about is if there's epidemiology. You want to talk about it based on the scheme I gave. If there's any epidemic, you want to talk about it. And it is believed that over 2 million of people are affected, of women worldwide are affected. Over 2 million of women are affected worldwide. So the patient shouldn't be scared. People are having it, okay? So you want to talk about the causes, or let's say the etiology or the risk factors, the causes, okay? So under the causes, doctors, it should be a group thing. Everybody should type. What is the major cause? The first question, the major cause of vesicovaginal
prolonged labor.
Please take note because of MCQ, doctor. The major cause.
Prolonged labor.
Okay. When the labor is prolonged, it could be a major cause of vesicovaginal fistula. And apart from this, we can have other reasons. Things like rape. You can have things like rape could be a common cause of vesicovaginal fistula. Please, I want us to take note, please, doctors. Okay.
Prolonged or obstructed.
Yeah, prolonged or obstructed labor. Yeah, somebody please use the type box. Everybody should use the chat box instead. Please, let's use the chat box.
Is obstructed not the most common?
Please, let's use the chat box.
Is the most common, sir.
Let's use the chat box. No, prolonged is the most common, please. The prolonged labor, what will cause prolonged? It could be as a result of obstruction. Please, let's take note. Let's use the chat box. Yeah, thank you so much. Prolonged labor, yes. Yeah, assisted instrumental delivery. You're absolutely correct. Things like rape, things like practices, gishiri practice, traditional practice in Nigeria. This is very common. Traditional practice, like they call it the gishiri practice. The gishiri, yeah, gishiri practice. So the gishiri practice think there's S here. The Gishiri practice is very common. It's more like female mutilation. Female, I just say female genital mutilation. Mutilation. This is very common, doctors. Please let's take note, okay? So apart from that, somebody said accident. Yes, trauma. Yeah. Don't forget, in our environment, we want to discuss about what will cause it in our environment, in Nigeria, to be precise. So one of the things that cause it in Nigeria is what? Early marriages. Early marriages. It's very common. People practice early marriages. So you see a child of 10 years old is already married. So this could be one of those causes. Somebody said advanced cervical cancer. Yes, Dr. Rhoda, when you had advanced cervical cancer could also result into it. Yes, advanced cervical cancer could cause it. Early marriages. Somebody is saying, yeah, teenage pregnancy. You are very correct, absolutely correct, and so on and so forth. A lot of gynecological procedure, infections, yes. Instrumentation, you are correct, doctor. Instrumentation, or let's say in case of forceps delivery, like forceps delivery. So it could cause it also. Let's take notes. Yeah, rape. We've typed rape, doctor. All right. So let's continue. After you explain this, you might want to, a little bit, according to our scheme, the next thing you want to explain is probably pathophysiology. But I don't think you need to go into details of the pathophysiology but you need to explain to the patient what actually happened. Like because during labor, because the major thing here is obstructed labor, and sorry, prolonged labor. When there's a prolonged labor, a lot of things can cause prolonged labor. Obstruction could cause it. Those doctors that was asking about obstructed labor being the major cause. Prolonged labor is actually obstruction can result into prolonged labor, obviously. So when there's prolonged labor, the fetal head is always between the bladder and the pubic bone, that's anteriorly, and the rectum and sacrum posteriorly. So when the whole thing is prolonged, as a result of prolonged of that position, this can result into affection of the tissues around, and this can result into necrosis because the two tissues are entrapped between bones. So there's compression, so which can result into vesicovaginal fistula. That is the pathology behind it. But I don't think you need to go into details of that when you are counseling. You have 5 minutes. You don't have enough time. So you have to be as quick as you can when you are counseling. Okay? So you can talk about that if you want to. Let's just say pathogenesis. Pathogenesis. So the pathogenesis depends on, let's say, the causes. If it is rape, it's a different procedure. If it is prolonged labor, it's a different thing. So mostly, since it's prolonged labor is a major cause, so let's say during labor, the fetal head is between the bladder and pubic bone. This is anteriorly, and the rectum and the sacrum posteriorly. This is on the posterior side. So this will rendering or let's say putting the soft tissues, between bones. So this might result into obstruction. It can result into vesicovaginal fistula, but you don't necessarily have to explain this in details, okay? So just say it as simple as you can. The major thing, the next thing you want to discuss about is the clinical presentation. This is a very important aspect. So clinical presentation. So you want to talk about the clinical presentation. So somebody who has obstructed labor, how would they be presented? Their clinical presentation. Clinical presentation. So what are the clinical presentations? Doctor, everybody should type. Somebody say comb biopsy. Oh, as a cause, smell of urine. Of course, there will be smelling of urine, but the major thing is what? The dribbling of urine. Thank you, Dr. Aisha. There will be dribbling of urine. Dribbling of urine is a very common thing. Doctor say incontinence. Yes, there will be urinary continence. There will be smell of urine. Smell of urine. The patient will be smelling urine when you see. So there will be dysuria, of course. Dysuria. What was that? Dermatitis. Yes, there's something we call ammoniacal dermatitis. Because of the urine and everything, it can cause ammoniacal dermatitis. Yes. Ammoniacal dermatitis. Okay. Doctor say UTIs. Yes, there could be UTIs. So, but what are these? Yeah, there could be UTIs, symptoms of UTIs. There could be things like amenorrhea. Patients might present with amenorrhea. Amenorrhea. Patient might present with vaginal scarring. Okay, etc. and so on and so forth. Okay, so this will be some of the presentations. Immediately after the presentation, you also want to talk about the classification. Please take note, classifications. So if there's any classification you want to explain, even before the clinical presentation, you might even want to explain classification before clinical presentation, please. So let's talk about classification. Classifications. So what are the classifications you want to talk about here? So there are different types of classifications, but the major one, there's classification based on anatomy. There's classification based on the size. So based on the size, so you want to talk, depending on the length. So this is based on length. So based on the size, we have extensive. Extensive is greater than 6 centimeters. We have the large. The large is what? Is
45
to 5 cm. We have which other one, doctors? We have the medium. Medium. We've discussed about this before. The medium is what? Is 2 to 3 centimeters. Yeah. And we have the what? The small.
Small. The small.
The small is what?
Less than 2 centimeters.
Yes, less than 2 cm. Okay, this is classification based on the size. You want to explain the classification. And there's also classifications based on the anatomy. We can have the juxta, urethra, depending on where it is attached to. We can have the mid-vagina. We can have the juxta cervical, depending. So I don't think you need to say more of all these things because you don't have enough time. So say the basics one and move ahead. You don't have enough time for it. You just have 5 minutes to cancel. So you have to be as smart as you can when you are canceling. Are you getting me, doctors? So immediately after we talk about the clinical presentations, also, the next thing to talk about is the complications. What are the complications people might face? What are the complications? Yeah, complications.
Endometritis.
Complication. So the complications might include things like what, doctors?
Endometritis.
It could result into endometritis, recurrent infection. Let's say recurrent infection. Doctor, somebody who is having dribbling of urine, it can result into emotional trauma. You're absolutely correct, Dr. Luashio. It can result into emotional trauma, psychological trauma, because the person will probably be avoiding gathering. Please let's take note.
Lost self-esteem.
Yeah, please let's type our answers, please. Let's type. Okay? Yeah. So it can result into emotional trauma, low self-esteem. Please let's take note. Okay, doctors? Yeah. Emotional trauma, low self-esteem. Low self-esteem. It can result into this. Do you understand? It can result into things like infertility. Infertility. It can result into segregation from the house. Yes, marital discord. You're absolutely correct, Dr. Quindalin. Yeah, it can result into marital discord or marital disharmony. So there might be problem within the family. You know, this country where we live in, people might even say it's witchcraft and all those things. Please let's take note. Okay, and so on and so forth. So immediately after investigation, let's talk about the immediately after complication. The next thing we want to talk about is investigation. So you want to investigate for this whole condition. So what do you want to do? How do you want to investigate? Very important, doctor. So investigation. Investigation is the next thing we are going to talk about. Okay, I believe everybody can see what I'm typing, doctors. So let's talk about the investigation. Investigation. You want to explain this to the patient. So for the investigation, what are those things you will do? So probably you want to do your what, doctor? A full
The
blood
3
count.
swab tests.
Yeah, you want to do the swab test. Swab test, the 3 swab test. Swab test. You want to do things like for your full blood count, FBC. Don't forget, it's very important. Your FBC, your EU creatinine.
Creatinine.
Yeah, you want to do everything. You want to do things
Urine
like
analysis.
urine MCS.
Mm-hmm.
You want to do your urine MCS? Yes, you're absolutely correct, doctor. Yeah, 3 swab tests. You're very correct, Dr. Gift. You want to do things like cystourethroskopy. Cystourethroskopy. Please take note. You want to do things like maybe grouping and cross-matching and so on and so forth. So immediately after that, the major thing, your major point here is the repair. It's actually very important. So your repair is the major thing. So treatment here is the repair. Mostly treatment is surgical. Treatment is surgical. So for you to do surgical treatment or to do the repair, you have to explain to the patient 3 months prior to that surgery or 3 months before that surgery, you have to correct any form of sepsis. So let's say 3 months before surgery, correct any form of things like sepsis, normalize the blood pressure, anemia and everything. You normalize the patient. If the patient is malnourished, you want to treat every form of malnutrition. You want to treat every form of malnutrition. You want to properly rehydrate the patient. Then after rehydrate, you want to make sure you apply proper, what's it called? Urine drainage properly prior to surgery. So let's say urine drainage before surgery. So doctor, this surgery is very important. You should know the name of the surgery. And the more major surgery you use or you do is your LASCO surgery. Please, doctors, take note. That's the name of the repair. Thank you, Dr. Luashev. Yeah, LASCO surgery. This is very important. So this is LASCO surgery. You have to type it out and let the patient know. You have to tell the patient the LASCO surgery. So this surgery is done by exposing the fistula using episiotomy. You cut and you open it in different positions depending on where the localizations of the fistula determines the position the patient will stay. But I want you to note that this surgery is very important when you are counseling. So you tell the patient the surgery will be performed, which is called the LASCO surgery. This is a repair. So after this repair, it's very important to assure the patient and talk to the patient about post-operative management. So post-operative management, post-operative care. So post-surgery, there are some certain things you will do to the patient. So you want to continually, you want to do catheterization. You want to sustain your catheter, proper drainage for like 14 days after the surgery, or like let's say 14 days.
10 to 14 days, I saw.
Yeah, within 10 to 14 days, yeah, after the surgery. Please take note, okay? So within that range, you want to catheterize the bladder. You want to give proper fluid, rehydration. You give proper fluid rehydration. Give antibiotics. Give your antibiotics is very important. Give things like quinones and all the rest. So apart from that, also very, very important, you have to warn this patient to abstain from sexual
sex
intercourse for 3 months.
for 3 months.
Yeah, please take note, doctors. Abstain from sexual intercourse or any form of sexual contact for 3 months. Okay? So let's say abstinence from sexual intercourse for 3 months. Do you understand, doctor? Yeah, and you also avoid childbearing for at least 1 to 2 years. Yes, you're absolutely correct. And avoid childbearing for 1 to 2 years. That's the doctors. Please take note. This is just a summary of the clerking you are going to do, of the counseling you are going to do. These are the basic things you need to educate the patient about. And you have 5 minutes to do all these, doctors. You have 5 minutes. 5 minutes. You can do it. You can achieve it. It's not that long. Are you getting what I'm trying to insinuate, doctor? It's not that long. It's very easy. You do your introduction. This one, you know it, like you have to get used to it. It talks about the definition of vesicovaginal fistula. Talk about the causes, the pathogenesis, if time permits you, very fast. Then you talk about the classification, clinical presentations of it, then complications, then investigation, treatment, and the procedure, the operation. So don't forget there are other classifications here. We also have the classifications based on the anatomical locations. If you want, you can include it if time permits you. But for this exam, you have 5 minutes. So I encourage everybody to train for 4 minutes for the counseling station, for the OSCE stations. Okay. Doctors, any question regarding this counseling? Any question regarding counseling on